Um, and now I'm trying to complete a Master of Liberal Arts in Clinical Psychology at Harvard University. But in addition to that, I have different certifications in different realms relating to high school certifications and different accounting ones and business ones as well. And just so you understand where my bias is coming from with the information that I'm giving you, I have different experiences in higher education. I've been in higher education now for 9 years. Different businesses that I've been in, different counseling, different parts of counseling that I handle on a probably daily basis, dealing with depression and anxiety, and different types of ministries that I've handled as well, being a chaplain in certain hospitals and any type of other type of interpersonal relationship counseling. So first, to start us off, in order to better understand the framework that we're coming from, we have to understand anxiety as it's defined. So everyone feels anxious now and then, and it's basically a normal emotion. Many people feel nervous when faced with a problem at work, before taking a test, or even just making an important decision. So anxiety disorders are different though, right? They can cause such distress that it interferes with your ability to lead a normal life, which your body demonstrates in different ways that we'll reference. To make the topic of anxiety even more relevant to the presentation, I have dug deeper with a better indication of what anxiety is from an academic standpoint. So as you can see here, I state that academic anxiety is the feeling of being distressed, fearful, or stressed out as a result of academic pressures. And why is this significant for us today? Well, the landscape of mental health is changing as more studies arise. Anxiety has now surpassed depression as being the number one mental health issue on college campuses. In fact, in 2015, American College Health Association survey reported that nearly 1 in 6 students, which is 15.8%, had been diagnosed with or treated for anxiety. The same survey found that 21.9% of students said that within the last 12 months, anxiety had affected their academic performance. And what I define as academic performance is receiving a lower grade on an exam or important project, or receiving an incomplete or dropping a course. And I think a lot of us on the phone have experienced those who have experienced that or have personally experienced that ourselves. And as we know here that there are many negative effects of anxiety that I won't dig too deep into detail about, but there are moderate, severe, and panic levels of anxiety, which can affect cognitive abilities towards a body's reaction, showing decreased focus and attention and difficulty of communication. All of these often lead to poor academic performance, and that's why we're here today. So some of the common issues when we're dealing with this type of academic anxiety, one of them is worry. And I indicate that worry are thoughts that prevent you from focusing on and successfully completing academic work. Some examples of that may indicate predictions of failure, self-degrading thoughts that either come from yourself or from others, or preoccupation with the consequences of doing poorly, so you're scared of not doing well. Emotionally, there are some emotional elements to it. Biological symptoms of anxiety. So, for instance, a fast heart rate beat, sweaty palms, and muscle tension. Another point is task-generated interference. Behaviors related to the task at hand, but which are unproductive and prevent successful performance. All right, so some examples of that are constantly checking the clock during an exam or spending a lot of time on a test question you can't answer. Another point, another common issue is study skills deficits. So problems with your study methods, which which create anxiety. For example, last-minute cramming. I know these are all things that probably a lot of us have experienced, the last-minute cramming, resulting in not knowing answers to test questions, or poor note-taking during lecture, resulting in the confusion of the major assignment. I guess the real benefit of knowing all of this is that I strongly believe that all of these things are treatable. Now, what's the common myth? The common myth is that anxiety can only be a bad thing. That's what they normally tell us, right? Anxiety can only be a bad thing. So with all of these things I mentioned and what our environment says about anxiety, this is one of the common misconceptions. But before you just hang up the phone or click out of this presentation, let me just go even further. Now, without any anxiety, many of us would lack the motivation to study for exams, write papers, or do daily homework. I mean, think about that 20-page paper about a topic in an English composition course that you really don't want to take, right? You really don't want to write that paper. But some people just do well under pressure, and I know that for me as well. Sometimes I just do better under pressure, where all of the focus level and the ideas start coming together when I know that something is due. Why? Because I know that I have no choice. And you can say the same thing as an athlete. There's several athletes who do very well under pressures, maybe a last-second shot, and then there's those that really fold. So there are some that are anxious during the process that makes them better than their normal self, and there's others that just fold during the limelight. It's also been noted that moderate amount of anxiety actually helps academic performance by creating motivation, right? So kind of creating that motivation that this has to be done in this amount of time. The assignment is due by 12 a.m. on Blackboard or another platform, and you're trying to submit it by 11:59 p.m. There's a lot of pressure, and you start working better, and I've been through that as well. So people who score higher on measures of anxiety also tend to perform better on intelligence tests, especially on verbal intelligence. In addition, anxious people have fewer fatal accidents, probably because they're thinking ahead of avoiding tasks. So these people who are so anxious of avoiding these fatal accidents, sometimes these people are so afraid that they take no risk at all. And that's not going to work with everything, right? Because if you're a business person and you're really trying to get into the market, you have to take risks. And this type of individual who is so anxious that they do nothing doesn't usually fare well. So even more is shown about anxiety and how it can deter academic performance by a study I conducted of 10 Latino graduates at a community college. Right? The purpose of the study, when I did it, was to gain insight into the factors associated with academic resilience from the perspective of first-generation Latino students who have completed an associate degree. So one of the questions I answered was, what risk factors affect the academic success of first-generation Latinos who have graduated from a community college? So the data showed that being unprepared, which I define as the state of being overwhelmed because of the lack of preparation to reach academic achievement in the college setting, and the lack of social and academic integration, which were some of the top risks of why some students are not academically successful, showed me certain indicators of how we can help them with their coping mechanisms. So knowing this, what does it do for us? This means that if we help them become better prepared and create an atmosphere that's conducive to their success, they too can succeed. Overall, there are things that are kind of outside of our control, but as far as actually knowing what the issues are sometimes will really help us out. So in this study that I conducted, there were 4 protective factors or coping mechanisms that help the graduate succeed, right? And as far as protective factors, if you don't really know what it is, it's an internal or external asset or resources and strengths that help the student increase the possibility of success, right? So I'll go over some certain type of factors here, all right? So perseverance. I'll show you in another questionnaire later, but what allows me to help most with sharing their story or understanding exactly who they are, and when I study the phenomenological study, is really just asking them questions and understanding their lived experiences as individuals. Because internal motivation was a coping mechanisms, I usually ask things related to perseverance, like what motivates the student to persist, right? Or what do they like doing most? I also often ask questions about their family, because familial support was second most important factor to the academic success of the graduates, right? The participants, when I studied them, they felt a sense of support from various family members, including spouses. Most of the students discussed their decision to enroll in colleges with their parents. So despite the lack of knowledge from their parents and of their education system, many of the graduates said that their parents provided motivation for them to succeed, right? So these are reasons why I'm asking about familial support, because if I understand their family dynamics, then possibly I can use that as a tool to help them succeed as well. Other points that I conjured up from the study is spirituality, and more specifically, what they were referring to as prayer was mentioned several times in the study. So I often ask students if they have any type of affiliation, if they're connected to any type of religion, and maybe start to gauge based upon that how I can help them within that framework that they do understand. Or even sometimes I just ask questions about the support group so that I can understand what type of constituents that they have around it. So, for instance, some graduates told me that, I think about 3 graduates told me that they worked in supermarkets, and when I was referencing how did they continue to persist throughout their education, they said that some people that they worked with at the supermarket really helped them out. So there is individuals who already graduated in a bachelor's program, or there were other individuals who were just rooting for them so they can get a better job. So just understanding the dynamics of your student and what type of constituents they have around them will help you better guide these students to academic success. And when we speak about these coping mechanisms, right, I know we mentioned the common issues before. So here are some of the coping mechanisms to make them to make these students better than what they were before as far as their academic resilience. So when we're referencing worrying, what we can do is use positive mental imagery and other types of thoughts, of self-defeating thoughts, and try to push them away. And even when we talk about the emotions of the individual, just muscle and breathing relaxing exercises, which I'll go over in later slides. Also, with the task-generated interference, work with a study skills instructor, and that's what I often propose. Sometimes there are academic tutors on campus that can maybe give them some tools so they can feel more confident upon the subject that they're referencing. So again, the study skills deficits, maybe if you have a study skills instructor, I know there's a small budget for that at times, but maybe if you contact your academic support help at your institution or wherever you are, maybe that can help as well. And one thing that I like doing now is something called mindfulness. So what has helped are actions based on mindfulness. So based on a lot of research that I've been doing, mindfulness has been working. And I indicate here that mindfulness is a state of active, open attention on the present. Because when you're mindful, you observe your thoughts and feelings from a distance without judging them, usually good or bad. So instead of letting your life pass you by, mindfulness means that you're going to live in the moment and through every awakening experience that you currently have. Right? So how is mindfulness really going to help us out right now? One of the aspects about mindfulness is mindful breathing. Now just consider this. While in labor, deep breathing can help women focus during contractions, release tension, and lower anxiety. But what I'm saying here is that whether or not you're pregnant, pattern breathing has been proven to help in coping with various types of pain, discomfort, anxiety, and fear. And how do I usually do this? I got these mechanisms from a class that I was taking at Harvard called Emotions. And before every class period, we would go through certain breathing exercises just so we can all calm down and be more level-headed throughout the conversation, right? So what I normally do here in these types of situations, I just have a certain script, and I have different scripts, but this is one of the scripts that I use. I go on to say, relax, get as comfortable as you can, settle back and breathe deeply, keep breathing deeply, exhale slowly. So I go on and I go on and I do things that help us recall some of the facts of the script, right? Of your mindful script in order to gain the positiveness inside of your mental capacity and inside of your cognitive abilities, right? So recalling the facts is stating here, you passed the last one and did just fine. You knew it all last night when you studied for the exam. So you're giving them that positive reinforcement so they can feel better about the situation, right? And then you kind of slowly end it based on that relaxing type of period. Relax, loosen your neck muscles, breathe deep and exhale slowly, and then end it with another piece of positive reinforcement, which is you can do it, right? So that's what I normally like to do in different types of settings. Of course, I'm not saying that I do that in every class, but I think that's one of the points that, based on research that I've been seeing, is a good piece of data to share. We also have points of mindful appreciation. And as I indicated before with other questions, it's good to find out what they enjoy. Because once you can find out what they enjoy, you may be able to use those same thoughts on gaining positive thoughts throughout their life in order so that they can attain academic success by decreasing their anxiety. So certain examples that I have are, I love the park. I love spending time with my family. I love sports. I love movies. I love writing. So they may say all of these things and just take them and use them to your benefit and really trying to understand who they are. Right. So some of the questions I may ask are, have you ever properly acknowledged how these things benefit your life and the life of others? Right? Because helping them acknowledging all these good aspects about their life will help them decrease their anxiety when they're thinking about the exam. Right? So even if we look at studies based on middle schools or elementary schools, just the anxiety of these children of not knowing if they're going to be able to eat at home later after they come out of school makes them really anxious, and they don't normally do well on these exams. Right? So what have several institutions implemented? They've implemented free breakfast, and they've implemented free lunch, and because of that, the anxiety has decreased, and the academic scores in certain districts have significantly increased. So we know that based on several pieces of data and studies that we have, that decreasing the anxiety in different parts of somebody's life can increase their academic performance. Another coping mechanism that I like to use is listening, right? So even within my own life, now I have to, instead of always prescribing something, having a resolution for something at the exact time that somebody tells me their situation, you just have to sometimes just listen, because telling the story, the student or the sender of the information, telling the story happens to be very therapeutic for them. And sometimes all they want is a listening ear. So listen to provide positive reinforcement afterwards, not always in a way to respond with a solution. So active listening is a way of listening and responding to another person that improves mutual understanding. Because often when people talk to each other, they don't listen attentively, right? Think about all the times where maybe your kids or maybe another friend or somebody else that you don't know is giving you a story, and maybe they ask you a question and you have no idea what to respond to because you weren't actively listening. You weren't attentive. So oftentimes we're often distracted, half listening and half thinking about something else at the same time. So alleviating those type of distractions, really listening to the sender of information, will help them cope better because you'll be able to relate the conversation and whatever it is and whatever advice that you have to give them based on the context of what they gave you before. Other points about listening. So first, the listener gains information because active listening encourages the speaker to talk about more things in greater depth than he or she would be likely to do in a simply responding to directive questions or suggestions, right? So now we get to speak to them in greater depth. So such depth of discussion often exposes underlying problems. So how can you really know how to help out this student or this other individual without really digging deeper to the underlying problem? Secondly, the appearance of elements of listening orientation, which include empathy, acceptance, congruent, and concreteness, are likely to increase as the reflective listening process continues. These are the ingredients that you need for an open, trusting relationship with that student, right? So once you show empathy, once you accept whatever their truth is, and once you show them that they can trust you with this information because you're actively listening, the relationship may be able to foster better than before, and you can help them in different ways to alleviate their anxiety. So finally, that third point, active listening stimulates and channels motivational energy. As the listener, you accept and encourage the speaker, but you leave the initiative in their hands. So consequently, that student may be able to recognize new avenues for action and will begin making plans to pursue them, making themselves more effective and productive. So you just giving them that positive reinforcement, sometimes they already find their own answers because of your positive reinforcement. They're excited about it. And mainly, I enjoy listening because it is not only therapeutic to the emotions of the student or the person that I'm speaking with, it allows me to better understand their case, as I indicated before. So this often relates to something called attribution theory. So when we think about attribution, it's to explain by indicating a cause. Attribution theory, as it suggests here, it's a motivational theory looking at how the average person constructs the meaning of an event based on his or her motives to find a cause and his or her knowledge of the environment. So the purpose behind making attributions is to achieve cognitive control, right? So once you start getting the student to realize that they have control over certain situations, their anxiety should be able to decrease. Right? So once you start explaining and helping them understand the causes behind their behaviors and environmental occurrences, then they should be able to overcome them. So in short, what does this mean? Attribution theory is just really about understanding why people do the things that they do. And once you have a better understanding of why they do what they do, you should be able to help them. You should be able to refer them to the exact department that they should be referred to, or maybe the exact counselor that they need to combat their anxiety. So according to the attribution theory, students need to feel in control over the outcome of academic tasks, right? Students will not feel that success will change and change is possible without feeling control over the causes, right? And that's with anything in life, right? The doctor tells you that you need to decrease your blood pressure, and the doctor is basically giving you some options. You can take medicine, and you can diet and exercise, or you can do all three. So you just having power over that allows you to maybe be propelled to get to the next level. The test anxiety inventory. So there are some questions that I sometimes ask based on a file that I have here, and I'll show you the file. I'll share with you. File. Hold on here. Okay. Okay. So let me put this bigger so you can see. So this is called the test anxiety inventory. So sometimes to just better understand these students, I often give them a sheet like this and ask them certain questions, and based upon the answers that they give me, and just be able to gauge exactly where they are in their development right now. So there's an instruction right here that I normally just leave in. It says a number of statements which people have used to describe how they feel about taking tests are shown below. Read each one and then select an answer to indicate how they feel, right? So we have these certain indicators: almost never, sometimes, often, and almost always. So one of the ones I have here is I feel confident and relaxed while taking tests. So if they don't feel confident and relaxed taking tests, maybe they say sometimes or often, then I can dig even deeper and try to understand why it is that they're indicating this. Try to really understand the lived experience, right? Some other questions are, during tests, I feel very tense. So just asking them why they feel very tense. Ask them to explain even further. Maybe they feel very tense because of something which happened to them, maybe with another instructor, right? So we really don't know, right? Often I feel my heart beating very fast during important tests. And that's when we get into maybe these statements of mindfulness, just really trying to give those positive reinforcements so they can do better, right? So I don't normally put a score on this. I just leave it as is, because this is really a sheet that I'm really trying to gauge exactly at what point in this question where they are, right? So if they're almost always or almost never, of course, if it's almost never, then I don't even have to touch upon it, right? So I'm really thinking about almost always or down to sometimes, okay? So getting back to this, I'm going to go back to the slides here. Okay. Okay. So some reminders I think that we should all take into account as well is that students of all academic achievement levels suffer from academic anxiety. So what I don't want us to do is kind of think that these things are for a certain group of individuals. We all face that same type of anxiety, maybe not at the same level as others, but some type of anxiousness that we have with whatever task that we're given, or maybe through something academic as well. So frequent poor performance, poor academic performance can increase anxiety levels, and we spoke about that before. And what I'm saying is here that perfectionists can also suffer from a high level of anxiety. So you have those type of perfectionists that it may help them get to the next level, but then you have some perfectionists that, you never get anything done, And I think about that just with book writing, where somebody wants to write something, but they just want to write it perfect. They want to write it so perfect that they never get anything done. So perfect that they never publish anything. So we need to be mindful of those type of students that are constantly looking for that perfectionism and trying to give them tools to navigate how they can better use their time. How can they allocate their time to better resources than just seeking perfectionism in every academic pursuit? Right? So that's what I have for you today. And now I'm going to open it for any type of questions or comments you may have. So anybody in the chat box can ask me any questions, and I'll surely answer them. Okay, I'm going to wait a few minutes to see if there's any questions or comments. Okay, thank you. I hope that all of us have learned something about that. Okay, Kristen, you're saying teaching mindfulness to adults can be difficult. I would imagine it would be more challenging to present this technique to college students. Any suggestions? Right, actually, the class that I was taking, it did have older students, but being that it was in a different dynamic, it was mainly with psychology students, so they understood that certain dynamic. So for me, I normally teach accounting courses, and with those accounting courses, um, I'm very blessed in the fact that they're really on point with their information, so they do their homework and things of that nature. When we talk about anxiety, I normally pull them to the side and start asking them about their family life and really giving them tools on how they can try to decrease their anxiety. So one way that I help them decrease their anxiety is tell them tools that I'm currently using. Some of the tools that I currently use are having spreadsheets for different tasks that I have, right? One of the other tools is goal setting, just writing down all my goals. Another tool is that I have a little notepad with me every single day, right? So with this notepad that I have every single day, I'm writing down all of my tasks. And if I don't write them all down, then I start to be anxious because I know that there's something that I'm possibly missing. So in general, I start giving techniques that they can implement right now with a sheet of paper and with a pen or with their phone to start creating alerts on things that they should be completing, because a lot of our anxiety, as I indicated before, it comes from the lack of unpreparedness. So that lack of unpreparedness is making them more anxious than normal. So if they started to spread out their tasks throughout a certain amount of days, then possibly they would be less anxious. So the techniques for the college students, as far as any suggestions on that, I would probably start gauging the class and say, hey, does anybody practice yoga? Does anybody practice any breathing exercises? And mainly just try to have a conversation about other type of techniques that they're using to help them, right? And in engaging in that conversation within that platform in the classroom may foster another idea that most people agree with anyway, right? So I'm not saying that you're going to push the idea of mindfulness. You're going to have first a conversation of ideologies that they're currently using right now to help them cope. And if they don't have any any tools to help them cope, then you start giving them ideas, right? So another person is saying, can you give us an example of a complex case you encountered and how you dealt with the anxiety of the student? I think there are some complex cases. I think dealing with, and we didn't cover this, but dealing with students with disabilities. I've dealt with students with disabilities who don't want to indicate that they have a disability. They may have ADHD, right? They may have some type of cognitive disability, and sometimes people don't want to admit it. Or maybe sometimes they just don't know. So I think that, like I said, the listening part is very important for me. The interpersonal relationship is very important for me, because once the student or whoever you're speaking to starts believing that you're on their side and you want the best for them, they start telling you details that they wouldn't normally tell anyone, right? Because you're building that relationship. So any type of complex case that I have, dealing with any type of disability, or maybe I've dealt with students who are homeless, right? They're homeless at the time, and their anxiety is because they don't know where they're gonna sleep at night, or maybe they don't know what they're gonna eat at night, right? So what I do with that is think about all the resources that I know on how to refer that person to other points to help them out. So one student, they were homeless. So what did I do? All I did was a basic Google search of homeless shelters in the area. I gave that person the information, and they were excited because they were like, man, no one really helps me. Everyone's like, hey, you know what? I hope you find somewhere to sleep. So me taking that initiative and showing that I'm really for that person and I want the best for them has changed that dynamic. And their anxiety has decreased because they know that they at least have one person on their team who's helping them reach that academic success. So what I'm saying here is the minimal that we can do is just try to speak to these individuals and show them that we're people too, and try to build those interpersonal relationships, because these relationships can be lifelong relationships. And I take it that every student that I experience is mainly somebody that's going to be my mentee, right? So I treat them as if I would want a mentor to treat me, right? So another person is indicating that job searching and interviewing can definitely cause stress and anxiety. Yes, a lot of stress and anxiety. As some of us have been through that who are on the who are in the session right now. And all I can do is, in those cases, just say that put your best foot forward. Is this the best resume that you currently have? Are these is your resume pertinent to the type of job that you are applying for? Right? So what I always say is competence builds confidence. And once you're really competent about where you're applying or the skills needed to apply certain places, or maybe going through different interview techniques, then hopefully that decreases anxiety. And I feel like a lot of students or a lot of job seekers are anxious because, again, we're going back to the unpreparedness. A lot of individuals are just unprepared, and maybe they don't know how to be more prepared. And that's where we come in. We come in to try to lead them to becoming more prepared than what they were before. So what are we going to do in that sense of job searching and interviewing? We're going to maybe go through an interview with them, a mock interview with them. Possibly we're going to give them some different websites. Possibly we're going to give them different leads. Maybe we're going to review their resume with them. Maybe we're going to dissect their resume even more than before. Maybe we start asking them how many resumes are they actually sending out. I've spoken to individuals that say that they're really trying to find a job, and I'll ask them how many resumes did they send last week. They'll tell me like 3 resumes, and they're waiting for the call back. And then I'll say, well, there's a lot of individuals who are also applying to that same job. Sending out three applications is not going to get the job done. And at a certain point, I was reading this study. The study was indicating that 10% of your applications you'll actually get a response from. And that doesn't necessarily mean you're going to get an interview. That just means a response, maybe a thank you or something like that. So what does this mean? This means that you can send out 100 resumes within about a month period or maybe a week period and only get 10 responses. So just knowing these type of facts and helping them be more competent about the task at hand, hopefully it should help them decrease their anxiety because now they know what to expect. So maybe they're sending out 3 resumes, three applications, and expecting 3 callbacks. But however, if you gave them the information on the statistics, maybe they would understand that, man, I can't just send 3 out. So maybe sometimes we're just anxious over nothing. We're anxious because we're not knowledgeable enough. We're ignorant about the fact of the whole process. Right? So I hope that answered some of your questions. Does anybody have any more questions? Okay, any more questions? Okay, well, it was great having you all. And again, you can contact me anytime. Thank you all for being on the phone with me throughout this session. Thanks a lot. You have my contact information here. You can email me at hep@professorfanor.com. And if you have my website there, so that has other information about me, or you can contact me at 908-349-0574, so we can just speak about how to help these individuals who experience anxiety, academic anxiety, to become better than what they were before. All right. So again, I'll see you next time. And again, if you have any questions, you can surely just contact me. Everyone, have a great day. Have less of an anxious day, because there's always tomorrow. Well, not always, but hopefully there will be a tomorrow.